Hi guys, welcome to my channel Evna Lifestyle. So today is about PID. I'm going to share with you guys what PID is, the causes, the treatment, and also the complications of PID, right? So this this month of February is just about health contents only. That's the only thing that we're going to be dealing with this month. And I know that when you guys go to the hospital, they send you to do a scan or maybe lab test, then you are told that you have PID. You have no idea what PID is. Like everything, I could just feel so confused, and yeah, you just have no idea what PID is all about. You are given medication, and yeah, so I'm going to share with you guys what PID is, and also just to have a clear picture about PID. I will explain it in a simpler way so that you understand. If you have any question, addition or subtraction or contribution or anything, you can just put them in the comment section. So let's get into this. PID is the abbreviation of the term pelvic inflammatory disease. So it's a general thing to say there is inflammation in the pelvic area. So that's the pelvic inflammatory disease in the abbreviation form PID, right? So the PID is the infection which happens to the female reproductive system. The female reproductive system, we are talking about the uterus, the cervix, by the way, the cervix, the uterus, the fallopian tubes, as well as the ovaries, right? So if there is any infection maybe to any part of these reproductive organs, any part for the female reproductive organs, definitely, if there is any infection, then there will be inflammation in all that. So that's what PID is all about. It's just an infection to the female reproductive organs. That's PID. So PID is caused by so many things, and one of the things that causes PID are sexual contact, right? Sexual contact, that is if you're not using protection. Yeah, if you're not using protection, or if at all you have multiple partners. Second one is surgery, then abortion as well, and also if you are using public toilets, right? So these can cause PID. By the way, PID is an infection, right? So if there is a bacteria in the reproductive system, then that causes PID. Infection, we are talking about the bacteria being in the pelvic area or the female reproductive organs, right? So those are the causes of PID. Symptoms of PID includes a pelvic pain, like severe pelvic pain. I'm sure a lot of you guys, you are literally victims of PID, and I'm sure you know the pain that I'm referring to, right? Then the second thing, you get to have a smelly discharge or a different color of discharge. So the pure discharge is supposed to be white, like pure white, but you get to have yellowish discharge. Then the other one is that you get to have loss of appetite. Then the other one, you get to have fever, and you also get to have pain when you're urinating. When you're passing urine, you get to have that pain. You also get to feel the hotness, like the burning sensation as you are passing urine, right? In the waist part, others get to have bleeding as well. Then just know that it's really severe. Before I reach to the treatment and also how you can prevent PID, let me just share the waste or the complications which comes out of PID, right? So one of them is that you get to have infertility because of PID. I'm going to share with you guys how that is caused about, but you get to have infertility, and others get to have ectopic pregnancy. I will explain that as well. Others get to have ectopic pregnancy, and other result is that one gets to have abscess, right? And abscess leads to operation, meaning that some of the things are going to be removed from the female reproductive system. If at all it's an ovary or the tube, the whole part is going to be removed, which is really bad thing. So the ectopic pregnancy, infertility or abscess, they come about when the bacteria or the infection goes into the uterus. When it is in the uterus, it's a bad thing, yes, but not worst when it reaches the fallopian tube. It's not going to be that much bad, or yeah, it is bad definitely, but not that bad when it reaches the fallopian tubes. So it's in the uterus, the infection is in the uterus. If it's treated there and then, well and good, you are served. But when it reaches in the fallopian tubes, that's the worst part, because the fallopian tubes, they've got the epithelium layer which has the mucosal layer, right? So when the infection reaches in the fallopian tubes, the mucosal layer is going to be inflamed. When it's inflamed, you know, the inflammation process, there will be kind of redness. There will be pain, definitely. That's the pain that you feel, the burning sensation, because there is an inflammation that is going on, right? So the mucosal part is going to be inflamed and it's going to produce fluid, right? So when the fluid is secreted in that area, the fallopian tubes are going to be filled up with fluid, and as the infection goes on and on, the fallopian tubes is going to be inflamed, it's going to have fluid, and when it's inflamed, there will be the thickness of that layer, right? So the fallopian tubes, that lumen, or we can say the tube of the fallopian tube is going to be inflamed, and it's going to be that narrow, right? It's going to be very, very narrow. It's going to be very small, whereby even the egg can't even pass, meaning you're going to be missing a lot of periods. And if that phase continues and continues, it's going to reach the ovary part. So the fallopian tubes is going to be inflamed, and also the ovary is going to be inflamed as well. So the body is going to sense that there is something that is going on down there. Something is not right. So it's going to send the white blood cells. It's going to send the white blood cells. The soldiers needs to go and fight for the body. So the soldiers need to go and fight for the body, right? So the white blood cells are going to be sent there. The neutrophils, the lymphocytes, and also the plasma cells, they are going to go there at that area or that region, the fallopian tube, where there is a mess, right? So they are going to reach there, and they will, by the way, the white blood cells are the soldiers, so they're going to engulf the bacteria. They're going to ingest and engulf the bacteria and try to crush it, and destroy it. Like it's out of the body. It's not really out of the body. They're going to ingest it. They are going to engulf it, and it's going to be destroyed within the white blood cells inside, right? So if they go there and they engulf the bacteria, and the whole process that is going to be taking place, there will be a production or the secretion of pus and also fluid because of the fight that is going on. So the pus and the fluid are going to start clotting up together, which are going to create the wall, the big pus or the abscess. It's going to be created like the wall thing, and there will also be kind of blood content inside, which is going to be a complex thing, right? So this is going to lead up one to have one can have arthritis, one can have salpingitis, or one can have salpingitis, a salpingo-arthritis, right? So meaning the infection of the fallopian tube as well as the ovary. So those two are going to be infected, and there will be need of operation if at all the other treatment of medicine are not going to work, which is a bad thing, definitely. Part of the abscess. Now for the ectopic pregnancies, while the fallopian tube or the epithelium layer is damaged, so as the egg is moving on, the egg is moving like they're supposed to be fertilization in the uterus, then the egg gets to be stuck in any part of the fallopian tube because some layers of the fallopian tube is damaged and can't really manage to pass through that egg to do the fertilization in the uterus. So it's going to be stuck in there, and the fertilization is going to start in there, right? Because the sperm has even met the egg in the fallopian tube. And then on the part of infertility, both eggs are infected and the layers are damaged, so there will be no way of an egg traveling or the sperm traveling going to meet the egg and all that. So those are the worst complications of PID. It's really, really bad. So we need to take care of ourselves. So PID can be found by so many ways. The clues, I should say. So one of them is the clinical findings. When someone is presenting with, the chills, when someone is saying that they are feeling a burning sensation, they're having the pelvic pain and all that, definitely those are pointing to PID. Now you just have to identify what's really, really going on in there. And also when it comes to scan, or should I say radiography department, so on scan, for you radiographers, if you are watching this part is for you, right? So not just radiographers, everyone. So for radiographers or on the scan, you are going to see fluid in the cul-de-sac, that is in the outer space, the space below the uterus. That's called a cul-de-sac or pouch of Douglas. So that part is going to be filled up with fluid. If it's measuring more than 1.5 centimeter, that's one of the things to say this is PID, but don't conclude it's PID, right? Because it's just the query of saying there is an infection in here, which has caused the remember I said when there is inflammation process, fluid is going to be produced, right? So if there is fluid in there, it means there is a core of an infection. So you need to do further, the clinician or the doctor will need to do further investigation to find out what's going on. You've given them a clue to say there is an infection. And also you will be able to see an abscess on scan. That's the best way of seeing if at all there is an abscess in there. You're going to see an abscess in there, and it's going to be complex because it has a lot of things in there, right? So it has pus in there, it has fluid, it has blood clots, it has so many kind of things which you're going to see on a scan. And if it's salpingitis, you're going to see like fluids in the fallopian tubes. So the normal fallopian tubes, you cannot see them on a scan. But if the tubes are infected, you'll be able to see the lining of the tubes, like they are really clear. The tube is clear, it's filled up with pus or it's filled up with fluid and all those kind of things. So in that way, it's going to help you, or it's going to help the clinician or the doctors to say this is what's really going on, things are not well in here, so that they know what kind of treatments are going to is going to be given to the patient. So radiographers, this is really a biggest role which you need to play in the patient's life, because if at all you miss this out, or you missing out, it's kind of normal because maybe you didn't pay much attention. That's why you need the help of other people. You need to involve other people so that they help you to see as well. A second eye is really good, and taking history of the patient is really good. So anyway, that's the talk of another day, right? So this is the part of the role of radiographers, the role of radiographers in the PID thing, or the PID patient, which is supposed to be played so that the patient gets to be saved, right? So the other thing is that the lab test, there will be some lab tests which are going to be done. So there will be for swabbing, there will also be for urinating, using urinalysis and all those kind of things. And they are going to check if at all there is an infection, what kind of an infection, and what kind of medicine can work to that infection. So yeah, in those ways, those are the biggest clues that can help the clinician or the doctors in how to treat that kind of PID, what kind of infection is in there, and all those kind of things, right? So treatment for PID, that's antibiotics. That is if there are any complications. If you're only on that part of PID phase and no complications, treatment, antibiotics. Guys, go to the doctor and you'll be told what kind of antibiotics, because I have no idea what antibiotics which are given. I might give you the some clues of medicine which can be given, but I don't want you guys to take medicine minus not seeing the doctor. So you need to see the doctor, because a lot of medications are very strong, and if you take them minus the prescription or minus being seen by the doctor, they can cause other complications. Liver problem is one of them, so you need to check into the doctor. So antibiotics is one of the treatment. The second thing is that you need to take a lot of water, plenty of water, so that your body gets to be washed away, right? And also you need to take, now this is the point that I'm going to say, is one of the things that you can be doing so that you avoid having PID, right? So one of them is that you need to be taking a lot of food which are rich in antioxidant. So the antioxidant, this is one of the substance that is really helpful in fighting against the free radicals in our body, right? So that they do not damage our cells. And the foods which are rich in antioxidant are those food which are natural, right? They are natural, they go to the farming thing and they plant them, they grow. And one of those kind of things I'm talking about is oranges, blueberries. I'm talking about what else? I'm talking about sweet potatoes, I'm talking about potatoes, I'm talking carrots, tomatoes, and broccoli. I'm talking about those kind of things. So you need to avoid refined food. I'm talking about white bread, I'm talking about pasta, those things that are refined. You can be having them, but you need to increase the amount of things that you eat which are just natural, right? These are going to help you in fighting against. I'm not saying that you will never have PID if you're taking these things. You will have PID, but it won't be frequent compared to one who is taking refined food all the time. So yeah, these are the treatments, and this is what I thought of sharing with you guys about PID. At least you have ideas what PID is all about, and Also, you also know the complications, so we need to take care of ourselves. We really need to take care of ourselves, making sure that we don't not use public toilets anyhow. And also, you have multiple partners, you need to reduce. You need to have one partner. Well, that's the correct thing, right? You need to have one partner so that you protect yourself from getting sick, you protect yourself from having complications. So if you have any questions and anything, you can just put them in the comment section. Thank you so much for watching, and see you in the next episode.